Welcome back. Much of the talk about the government shutdown is centered around healthcare and the future of programs like Medicaid, which will undergo deep cuts as part of President Trump's so-called Big Beautiful Bill. While the blame game continues in Washington, small towns and rural areas have already been dealing with decreases in service and care. Our senior Washington correspondent, Selina Wang, traveled from our nation's capital to a quiet community in Wisconsin, where 2 hospitals recently shut down, putting stress not only on the remaining medical facilities and professionals, but also those in need of serious care.
Over there, say 5 your way down here, and find out over there $4 on the back and find out over there behind. Shoulder $250.
Eric Halfin grew up in this house in Chippewa Falls, Wisconsin, not far from the Minnesota border. It was built decades ago by his late father, Terry.
Built everything, built all the buildings, the deck we're standing on, everything.
But today, his family is watching his possessions get auctioned away.
Sold for $7.5. 19 was the buyer, number 19.
How does it feel to be back here?
I'm not sure. Right now, I'm not sure how to feel.
This past summer, Terry died of cancer. He was being treated at the nearby hospital, Sacred Heart in Eau Claire, Wisconsin, but it shut down with little notice last year, terminating almost 1,400 employees. The city demanded the state investigate, calling the closure abrupt and devastating, but the state never opened an official inquiry.
What happened when Sacred Heart closed?
They didn't have the proper doctor to do the procedures that they were going to do on him. Because Sacred Heart had closed, there was no doctors in the area that could do that.
So Eric and Jamie drove hours every day to a hospital farther away.
So you're driving how many hours a day?
3, 6.
Yeah.
6 hours a day sometimes.
Eventually, the family brought him back home. 48 hours later, Terry passed away.
Had Sacred Heart remained open, would your father have been able to receive treatment?
Oh, he would have definitely been able to receive treatment in Eau Claire. I'm not sure if it would have extended his life any more than it did, but it would have been a lot less traumatic.
What happened to this family is just one story in a much larger crisis. Across the country, hospitals are vanishing, and a new wave of Medicaid cuts could accelerate the collapse. President Trump's so-called Big Beautiful Bill slashes nearly $1 trillion in Medicaid funding over the next 10 years. The administration says this cuts wasteful spending and will create a $50 billion fund for rural hospitals. But many health experts say that's not nearly enough. And already, nearly 100 rural hospitals have closed or eliminated inpatient services in the last decade, threatening healthcare access to some of the more than 16 million people living in rural communities who rely on Medicaid. While the full impact of Medicaid cuts could take years to unfold, doctors tell us the system is already buckling.
The closure of the hospitals here, it's not just a loss of care, it's actually a loss of life.
It is really loss of time, which in a critical disease state is super important, and it can be loss of life.
My age is like 40.
Dr. Brady Didion is just one of several doctors who left the area after St. Joseph's Hospital closed in Chippewa Falls, shutting down the same day as Sacred Heart Hospital in Eau Claire because of financial difficulties.
Sacred Heart Hospital ER signing off.
There were only 4 major hospitals in the region. Now half are gone, sending shockwaves through the community and the rural areas they served. Hospital Sisters Health System, the owner of those 2 shuttered hospitals, said in a statement to ABC News that closing them down was one of the most difficult and heartbreaking decisions, saying in part, the closures that are occurring across the country should be a wake-up call about the crisis rural healthcare providers are facing. Dr. Didion says those closures have led to conditions worsening in irreversible ways, or even death.
I've literally been up all night on the phone trying to call to get someone care who needed it in our small hospital because these places were full. I know that we have had delays in care such that it resulted in someone getting irreversible progress in their disease state or even dying.
Dr. Didion now practices at a rural hospital some 50 miles away.
So I think if Medicaid is cut in any state, I think rural communities are going to face challenges with hospitals not being able to offer as many services, maybe not as many doctors, maybe closing altogether. Many hospitals lose money on Medicaid every year anyways, and if fewer people have Medicaid or if the amounts are cut, it's only probably going to be a bigger problem.
So we're kind of like a jack of all trades job here, I like to say, because we do EMS, fire, hazmat, water rescue, special patient rescue. So
Brooke Sommerfeld is just the 4th woman to work at this firehouse since 1870, where a call can come in at any time.
Oh, yeah, that's a call. That's a call.
Brooke and the team feeling the strain from those hospitals shuttering.
At Aguenda County, did they advise what door? We have upwards of an hour sometimes with these critical patients, and we have the materials and the equipment to take care of them in here, but at the same time we don't have a surgeon. Obviously we don't have blood. Like what they ultimately need in the hospital we can't provide for them, so we're hopefully just keeping them, stabilized until we can get them to the hospital. You're watching these patients, sometimes they're waiting until they're sicker to call because they don't want to go the distance to Eau Claire for a hospital, and so they kind of wait and hope that they'll get better, and sometimes they ultimately get worse and then they're more sick when we see them, and so you're kind of watching them decompensate almost in the back of the ambulance when you have them for such an hour long time and you're providing the care that you can.
And how does it make you feel when, you're in this space with them for an hour and you knowing that you could have just taken them down the street and now knowing you don't have that option?
Absolutely, it's overwhelming. It's honestly overwhelming.
We're obviously only in Chippewa-Eau Claire region, but other communities could be facing the same situation you guys are. What would be your message to those communities who might be about to lose a hospital?
Buckle up. No, I would say that we all really just depended on each other, and then the other hospitals, knowing that it was going to be a challenge for everybody involved.
Somebody get $20 on the jumper cable, 5, 10.
And back at the Halfin family home, they're watching their memories sold off, piece by piece.
Well, it's been hard coming back here in the meantime, so to speak, since, to gather things that we wanted to gather. That was difficult.
So many closures affecting communities and many more cuts expected after the 2026 midterm elections. Our thanks to Selina Wang for that report. Coming up here on ABC News Live Prime, a comet is making a pass close to Mars. Just how close it will come to the red planet, that's coming up next. And the life of a Swiftie is pretty sweet right now, and that's thanks to the life of a showgirl. We'll take you inside Taylor Swift's latest era.